Good evening, everybody, and welcome. My name is Rebecca Russell. I am a patient education specialist with PMD Healthcare, and tonight we are truly honored to have Dr. Michael Blaiss speaking to us about the benefits of personal spirometry and how to integrate SpiroPD into treatment plans. Dr. Blaiss, he's a member of the Board of Directors of the World Allergy Organization and also a clinical professor of pediatrics and medicine, the Division of Allergy and Immunology at the University of Tennessee Health Sciences Center in Memphis. Welcome, Dr. Blaiss.
Well, thank you, Rebecca, and it's a real pleasure to be able to speak to everyone this evening and really have exciting information for all of us that take care of patients with chronic respiratory conditions such as asthma, COPD, cystic fibrosis. Because for the first time, we have approved by the FDA in the United States the world's first truly personal spirometer, SpiroPD. What I'd like to do this evening is give you important information of the role of spirometry in your patient population and why the use of SpiroPD in your patients can help empower them to take control of their respiratory condition and also to better inform you so that you can better control your patient. Because I think the bottom line here is with all these chronic lung conditions that we have in the patient population, we can't cure them. But with the medications and tools like SpiroPD, we can control our patient's condition and improve their quality of life. So, spirometry. And I guess the question is, why is spirometry so important? I think all of us that manage patients with chronic lung conditions understand that, one, in fact, spirometry is the gold standard. One has to do spirometry, in fact, to make the diagnosis of conditions such as asthma and COPD. But I think even more important spirometry is its role in monitoring our patients with chronic lung conditions. And we know that asthma continues to increase in prevalence in the United States and, for that matter, throughout the world. You may have seen just a few months ago released by the CDC the latest numbers of patients, people in the United States, in fact, that have asthma. In fact, they showed the highest level that's ever been reported by the CDC, that about 8.2% of the U.S. population now suffers with asthma, with the highest rate seen in the pediatric population, which is now 9.4%. And what we're also seeing as the population is aging is the dramatic increase in COPD in the population. In fact, it is thought that within the next 10 years, in fact, we'll have more patients in the United States with COPD than asthma. So we can see these two chronic conditions continue to increase and are major problems in medical care in the United States. Very importantly, with asthma, even though we've had great medications and new medications over the last 10 years to treat patients with this condition, when you look at asthma control, when you look at emergency department visits and hospitalization, in fact, there has been no decline. So we're not controlling our patients' asthma well enough. And I think one of the reasons is we do not have good objective measures that patients can do at home to monitor their condition. We know that in our office situation, the gold standard for assessing our patients each and every day we see them with asthma, COPD, cystic fibrosis, is in fact the use of spirometry in the office. And in fact, one, cannot determine the complete control of the patient's asthma without, in fact, or their COPD, without, in fact, routinely monitoring their spirometry in the office. But now what's real exciting with new technology, and we all see more and more new technology on a daily basis. Hopefully we can now, as we'll talk about tonight, have our patients be able to monitor their lung function at home inexpensively without the concern of insurance coverage as far as to have to keep having spirometry done all the time in the office situation. Now, we're all familiar with monitoring tools that can be used on a home situation. We have blood pressure monitors. In fact, I have one of these at home so that, in fact, at our house we can monitor our blood pressure. Diabetics now have glucometers that are very small, inexpensive. It can be used to help regulate their diabetes so that they can regulate their medication. But what have we had in pulmonary disease? And in fact, what we've had are peak flow meters. And as we'll talk about in a minute, they're not very accurate, in many cases just not that helpful, is the gold standard as far as monitoring a patient's lung function. And now what's really exciting is we'll spend time this evening and show you is now we have Spirometry approved by the FDA with ATS, American Thoracic Society standards, is a true personal spirometer. So now we have a device as good as what the diabetics have, what people with high blood pressure have, and now people with lung disease can accurately monitor their lung function at home. So why not? And I get this question many times. Why not just use a peak flow meter? Well, I think one of the reasons I don't use peak flow meters very often in my office situation is that in general, these are objective measures that we get from peak flow meters, and most of the time, we just can't really trust the results. They only give us really a partial picture of the patient's lung function. We're only looking at the patient's maximal speed on expiration. So we're not getting the gold standard, which is the forced expiratory volume in 1 second. So we're really not getting the results, though there is relationship, that we really want. The other problem is that the personal profile in many cases is not considered in the results. And when one uses a typical nomogram that's associated with peak flow meters, it may or may not be accurate because of the wide variation in health subjects. And I think this leads to many times patients telling us that their peak flow, in fact, is low when, in fact, it truly isn't. And unfortunately, and I've done one of these studies, in fact, this peak flow meters have not been shown really to prove asthma outcomes. And I think it has to do with a lot of the inaccuracy. We know that this is a difficult device to do correctly. And we've had many times, especially in the pediatric population, unfortunately, I've seen them fake the results of the peak flow meter to get out of the school situation. And unfortunately, that can be done. This is a mechanical device, the peak flow. It doesn't have safeguards to make sure that, in fact, the patient is doing proper testing. And I think this leads to the bottom bullet here, which is so very important. It's just not a very precise instrument. So it's not a precise instrument as we have for blood pressure at home, for measuring blood glucose at home. We need a precise, accurate measure that a patient can easily do in the home situation and get information that we as healthcare professionals can assess and help their patient in the control of their lung condition. Which goes back to why is spirometry so important? Because it's only spirometry, as we mentioned, that one can use to diagnose these conditions, but very importantly, as far as treatment of our patients with COPD and asthma, as we mentioned, it's the gold standard in our patient population. Now, I think it's very importantly, and if you look at it, we'll give an example for asthma. If you look at the NIH guidelines for the treatment of asthma, and you look at asthma control, not only do you ask patients about their symptomatology, daytime, nighttime, need for albuterol, but very importantly, one is asked to also monitor their spirometry. What is their FEV1? What is their FEV1 over FVC? So when one is looking at control of the patient, one cannot just look at symptoms alone. One needs to do objective measures, and that's why the NIH guidelines call for the use of spirometry in asthma. We also need spirometry to accurately diagnose and prevent exacerbations in patients with COPD. So with the ability of doing home spirometry, we are going to get accurate information on the patient's control. And I think the bottom line here, and to me what's so exciting about this, is that now we're empowering the patient. That the patient now will get information to help them better control their condition and so that, in fact, we can work together with the patient to get optimal control of their condition and work out the best treatment plan for them. And not just go on symptoms, but symptoms and objective measures. So what's the advantage to us as healthcare professionals? I think the more data that we have, because there is no one piece of data that tells us our patient's asthma is under control, by looking at symptoms and objective measures such as home spirometry, that can give us better ways of making informed decisions as far as changing medication for our patient. The use of this can help identify triggers, because now they could do their spirometry at work, so we could pick up occupational problems, or at school, where in fact there could be irritants or allergens in the stool that are triggering problems, so we can pinpoint those because they're able to do the spirometry in those locations. And very importantly, as we'll talk about with Spiral PD, we can get information as far as the patient's adherence to the treatment plan. And obviously, we all know in the management of chronic conditions such as asthma and COPD that, in fact, adherence is utmost as far as getting good control of the patient's condition. And just imagine if you could receive from your patient frequent spirometry results in between office visits. And I think with the changes occurring in healthcare, and as we move as far as paying physicians, as far as pay for performance and quality, that by getting this information and being able then to work with the patient, even when they're not in the office situation, to help control their asthma, will get better outcomes, and I think will be very important with the changes occurring in the healthcare arena. So we'll have the tools here to analyze the patient's overall response to treatment, not just when they're in the office setting, and this can lead then to better control of the patient's symptoms, decrease emergency department visits and hospitalizations. But what we really want for all our patients is better outcomes. Now, what are some of the CPT coding that's available? Because obviously we do have to do CPT codes, and are there CPT codes for interpreting results from home Spiral PD spirometric recording? And in fact, they may be reimbursable. There are two codes that you may need to look at, 94014, which can be used when a patient is instructed in your office how to integrate home spirometry in their treatment plan, and 94016, which in fact is a code where you can can be used for monthly interpretation of data. And I know I have a patient right now that has been sending me their information from their Spiral PD, as we'll talk about in just a minute, and we have submitted to insurance for paying of this interpretation. Again, I think all of us realize when we're dealing with managed care organizations that reimbursement is subject to local coverage decisions and private payer coverage policy. So what about the cost to the patient? And I think that obviously that's a concern, and that's been a concern in my patient population. But one of the things that I always stress here is that, in fact, when you talk about the high copays, as far as going to the emergency department for an acute asthma or COPD exacerbation, or you're talking about hospitalization, then I think it's very clear that Spiral PD would quickly pay for itself. In fact, it's affordably priced. It's $219. And I think the important thing is that's the whole thing. There is no need for any additional software or accessories. In fact, you have your choice of either a white or gray Spiral PD. It comes with a matching cradle, the power supply, the USB connector, so it can be connected to the computer. We'll come back to that. Mouthpieces for children and adults, rechargeable battery, user documentation. As we'll see in a few minutes, it's easy to train a patient to use, and a 1-year standard warranty. So what we're talking about is a medical device approved by the FDA, and I think one can see here how reasonably priced this is compared to the cost. Just think about the cost of medication for asthma for a 1-month period of time. So as I mentioned, this is the world's first approved by the FDA truly personal spirometer. And I think that's what's really exciting, because patients can take this device with them whether school or work, on vacation, so that, in fact, they can monitor their condition. And we know that by doing spirometry, we can catch symptomatology before, in fact, many times the patient has symptoms. So, therefore, we can prevent exacerbations and asthma attacks. And then the bottom line is look how this saves money, because this keeps the patient out of the emergency department and out of the hospice. I think what's one of the really exciting things for Spiro PD, and especially in my patient population, is tracking trends. So the patient, in fact, when, say, we put them on a new medication for their asthma, we can see over the next few weeks by tracking on Spiro PD if that treatment's working and whether we need to make any changes. And I think what's very interesting for the patient and for us also is by monitoring with Spiro PD, it's in a simple graph form. There's color coding that lets the patients, in fact, just glance at their current severity level. So they don't have to know exactly what an FEV1 is or FVC is, but by the color coding, knowing, in fact, if they are doing well or not. It really can help the patient remember, and that's important for adherence. One can set alarms, as we'll see in a second, so they can manage their medication, when to do their spirometry, or an breathing exercise schedule. Most importantly, it improves communication with the patient. In fact, by getting this information sent to you, or patients bringing it in when they see you on a regular basis, then one can, in fact, see how the patient is doing, and again, help better determine how to either step up or step down their respiratory treatment. And as we'll talk about here, it's really very easy to use. It has very intuitive software, color touch screen. Now with everyone having an iPhone and an iPad, I think everybody knows how to use color touch screens, and this, in fact, is just as easy as using one of those devices. So what does the Spiro PD measure? In fact, it does all the measurements that, in fact, that we have in our office spirometry. In fact, the results are fully comparable with office spirometry because, in fact, it's using the same standards. It's using ATS standards. And in the United States, the normogram, the normals have been set ethically appropriate from the National Health and Nutrition Examination Survey. The NHANES 3 reference for patients ages 8 to 80 also has levels also for patients below the age of 8. Because most of us can get children from 5 to 6 years of age also to be able to do spirometry. So what do we get here? We get, again, what I get in my office situation. Forced vital capacity, the FEV1, very important in pediatrics, the FEV1 FVC ratio for asthma, a peak flow, but we also get flow loop volume, volume time curve, the percent predicted, and as we'll talk about, severity level. So I know in my office situation, the numbers are important, but I can make out just as much. In fact, to me, the most important, in fact, is the flow volume loop, which gives me a good idea of asthma as far as the degree of obstruction. So again, all the information that one would get in office spirometry, but home use. So let's now look at how easy it really is to use the Spiro PD.
There has never been a spirometer like Spiro PD. As the world's first personal spirometer, it empowers you to easily and accurately monitor your asthma, COPD, including emphysema and chronic bronchitis, cystic fibrosis, and lung transplantation. Spiro PD is no ordinary spirometer, and it's certainly no peak flow meter. It's so much more.
I do the test, and my parents know how bad my asthma is. You know what to do or not to do.
Spiro PD is the world's first truly personal spirometer. That means no one uses it but you. Spiro PD is designed specifically to monitor lung function. Spiro PD features an intuitive, easy-to-use color touchscreen. Enter, store, and get your personal lung health information. It's as easy to use as a cell phone. Use it to track lung function anytime, anywhere. At home, on vacation, at work. school, play, and more.
So now I have my Spiro PD. It's been a real help. It's lightweight and portable, so I can test myself just about anywhere.
Manage your medication. Set alarms to remind you to test your lung function, take your medication, and do breathing exercises.
He just enters in all the prescriptions, the doses, days, and times he should take them. Then our Spiro PD automatically lets him know when to take his medicine.
Spiro PD lets you upload data and share it with your doctor.
And my Spiro PD makes sharing significant information easy.
Best of all, Spiro PD offers the same accuracy as your doctor's spirometer, so you'll be better able to track your lung health at your convenience. Easy, accurate, empowering. Spiro PD, the world's first personal spirometer.
So we can see then from that video how easy it is, in fact, for the patient population to use this. It's small, it's lightweight, it's portable, and as we mentioned, it's affordable. But I think very importantly, because we want patients to continue to monitor their lung function, it has to be easy to use, and in fact, as we've seen, it is. Let's just look at how this works and how easy it is for your patient population. So here's the initial settings. Again, you can see the screens here. The patients enter one time their personal information to set up the device. What language? It's in English and Spanish, and other languages will be coming shortly. Unit to measure, whether it be English or metric. Obviously, their name, date of birth, and these other things are important because, again, for the nomograms of the spirometry, their gender, height, weight, ethnicity, and also sets up time and date. So, in fact, one can look at trends as far as monitoring the spirometry and also for, as we'll talk about, putting in information about their medication. So here is the home screen when they turn on the Spiro PD. What you'll notice here is there are four major buttons that they would be pressing. So one is to run tests for them to do their spirometry. Two, you see view trends, and that's to look at the results of their spirometry and over time. We'll come back to that in just a minute. Manage medicines, where they can put the information in about their medication and set alarms when it's time to, in fact, take their medication. But, in fact, as you see the set alarms there, not only can they set alarms as far as when to manage their medication, but also, in fact, when to do their spirometry. You'll also notice at the bottom of the screen that there are left and right scroll buttons where they can look at what's been done in the past or what's scheduled as far as their alarms to be done in the future, a battery display, the time and date, and also information there as far as uploading data to their computer that can then be emailed to their healthcare professional to review the results of their spirometry. So a very easy home screen with the four major things that they can do with Spiro PD. So let's look at running a test with Spiro PD. And, in fact, we run this just like, in fact, you would run a test in your office situation. So you press the button there as far as run test. And I think very importantly, which you don't get with a peak flow meter, is the patients are coached throughout the process. Just like we have in our office when our respiratory therapist or our nurse, in fact, coaches a patient to do their spirometry. You really need that to get an accurate measure. So there's audible instructions. There's also an on-screen diagram, as you can see on your computer screen right now. And not only is there this, but there's progressive motivational light. So when you're blowing in, more and more lights turn on. So, in fact, that you can see that you are giving a good effort, something that, again, is not possible with a peak flow meter. And, very importantly, just as we do in the office setting, we do 3 tests are completed for each result set so that we can get, in fact, the best results. And then the results, as you can see here, are clearly presented. There's a color-coded severity level. So it tells your patient right there, and you can see here the severity, again, in the green. So it's good, normal, normal, normal. And again, you can see the results that the patient is getting here. Again, all the ones that you probably do in your office situation, the FVC, FEV1, even the FEF25-75, a measure of small airway function. Again, all the important results done just like you would in an office setting, but a personal device that it can be done at home. Now, what's also very interesting and very important for us is to view trends. So that, in fact, we can get all the patient's test results either in tabular or in graphic form, and we can get this data even a 7-day snapshot of what's happened over the previous 4 weeks, or the previous 14 days, or a 1 month or 30-day snapshot. And that the patient can also tab on the key terms here, so in fact they can learn what these different numbers mean, such as you can see here for the FVC. So in fact, these results can be downloaded in these types of snapshots and sent to us for our review. Very importantly is adherence to treatment, because I think that's one of the keys in asthma, and that is to make sure that patients are taking their medications regularly. And what one can do is not only do spirometry with Spiro-PD, but this is a device to help the patients, in fact, manage their medicine. So they can enter or edit their medication. They can review their medication history. They can set up here through reminders when it's time, in fact, to take their medication. It even has, I think, very interesting here, a snooze alarm. So if they don't really have time right that second to do their medication, they can hit snooze and it will remind them again in 5 minutes. And then, just as we saw with spirometry, one in fact can get information as far as adherence of their therapy. So what we see here at the bottom is that there's proprietary software provides a timestamp and color coding to show patients have been in fact following their therapy. So again, I think all this type of feedback, these types of monitoring, hopefully can improve adherence and outcomes in our patients with asthma. As I mentioned before, one can set alarms. You can set alarms for the patients to do their spirometry, to remind them, as we mentioned, about their medication. Also for doing breathing exercises. And the alarms can be either an audible bell or flash the LED light or present a pop-up message. And then the patient's able to log their action. So they can put whether they did their breathing test or log their medication or a breathing exercise. Or again, as we mentioned, they can snooze and be reminded again in 5 minutes, or they just dismiss and that they're not going to do it at that particular time. So again, very easy, as you can see on the screen here, to do these types of things with Spiro-PD. And what also is very easy, and that is uploading reports. So again, this information can be sent to us so that, in fact, we can review it. And what the patient does here is, again, goes to the uploaded report, and you can see at the bottom of your screen here, they can choose the report, so test results, a trend graph, a spirometry loop. You can see that they can choose either the last 7 days, 14 days, last 30 days. So what they do here, and it walks them through it, they connect the USB cable to the Spiro-PD and then connect it, the USB cable, to their computer. And basically, the Spiro-PD acts like an external hard drive, and they can then download the information from the Spiro-PD onto their computer, print it, or email it to you, or just save it until the, in fact, next visit, whenever you decide how you'd like the patient to do that. So you've got a visual way of seeing exactly the spirometry, as you would see in your office, that the patient is doing at home with Spiro-PD. So how would you include this in your treatment plan? I think for our patients, again, that have chronic lung conditions such as asthma and COPD, we know that monitoring their condition is very important. You could have the patient set up the frequency of how often they should do spirometry as far as monitoring their condition. And I think very importantly, because patients aren't going to always understand FEV1 and FVC, is that there is color-coded severity levels, and these, again, are derived from the data that the patient puts in as far as their personal profile, and therefore you can have the patient determine, depending upon whether they're having mild, moderate, or severe problems, when they see that information, what they should do as far as medical management, whether they should change their treatment, or in fact, should they call you for further instructions as far as control their condition. And I think what the great thing here is that in general, as we know, spirometry will change before the patient becomes greatly symptomatic. So we can pick up problems before they end up requiring emergency department visits or hospitalization. So this is a medical device that requires a prescription. So in fact, once you identify a patient with chronic lung conditions such as asthma, COPD, that would benefit from monitoring and better communication with you and your office about their condition, you can write a prescription and send it to PMD Healthcare, either by email or fax or mail. And the patient, in fact, can go to the website and, in fact, order a SpiroPD, and the website is spiropd.com. They can also call their great customer care and service center, and you can see the number here at 1-888-PMD for you. So, again, they have to have a prescription for this, and I think, again, working with the patient and working with SpiroPD can improve the patient's asthma and COPD, cystic fibrosis control. So I think what I'll do is stop there. Hopefully I've given you important information of why a personal spirometer can be so valuable to your patients with different chronic lung conditions. If you have any questions after tonight, again, you can call PMD Healthcare at 1-888-PMD for you, option 5. They have a great website with a lot of important information for patients about lung conditions and about the role of SpiroPD in helping them manage their condition, and you can follow them on Twitter and Facebook. So I'll stop there and see if, in fact, there are any questions or comments this evening. Rebecca?
Yes, Dr. Blaiss, thank you so much. That was wonderful, very informative and helpful. We really do appreciate it a lot. If anybody has any questions, again, feel free to enter them in that Q&A box, which can be found right at the top of the screen. And the Q&A experts will be more than happy to take your questions as fast as possible. Again, Dr. Blaiss, we thank you very much for your time. We hope to see you back at future webinars, and we also thank everybody who's out there tonight listening. Enjoy your night. Have a wonderful evening. Thanks again. Bye-bye.
Bye-bye.